health disparities that are going on, right? You can even see the cases of coronavirus change based on the zip codes all around the country, but especially in New York.
Yes.
How much do you feel that the health disparities that happened, that were kind of in place before the pandemic, have made it worse in these communities that you're talking about?
So the ERs that were like Elmhurst, the city hospitals, they were not functioning so well prior to this pandemic occurring.
Mm-hmm.
South Bronx, Brookdale, Elmhurst, they weren't high functioning before. So the pandemic kind of exposed some of the failures in the healthcare system. You have celebrities getting tested, whereas people that are like frontline, well, not even frontline providers, just essential workers, they're not even able to get tested. And you have celebrities getting tested twice, getting tested first to say they have it and then not getting it. So it's sad. And that's really what this pandemic showed, just showed the healthcare disparities amongst, in New York City. It sucks for sure.
Yeah, in my shop in New Orleans, testing was a huge issue because, they rolled it out and we never had enough tests to begin with. Even now, they're kind of stepping up their game, but it's still a huge problem. And it's hard to see. You'll see these basketball players. I know Rudy Gobert was acting crazy, touching the mic, and of course he caught it. Then other basketball players had access to it. And even those who didn't have symptoms got tested.
Yeah.
And so how difficult was it on your side? It took us a while to get tested. How difficult was it on your side to get tested, even with you being a healthcare provider?
So before February, I feel like we were testing, my emergency department, we were testing everyone. We were just testing and testing. And then it kind of was at a halt. And then it slowly became, you're only getting tested if you're admitted in the hospital. And if you're admitted for COVID, you're really sick. So when, I don't want to go too far advanced, but I was nervous because I was like, if I get sick, I'm not even qualified to get tested. And I'm here going to work, exposing myself to a whole bunch of people, exposing myself to my family, exposing myself to like coworkers. And testing was definitely, it wasn't fair the way certain people would get tested. As you said, celebrities that typically, if they showed up in an emergency department, they wouldn't even meet criteria to get tested, yet they were getting tested. So testing, initially it was like testing everyone, then we stopped. Then now I think urgent cares are testing a lot. They're testing more than the emergency department. In the emergency department, we are not testing you unless.
Yeah, that was the same thing with mine. And it's not, you're right there, Nefertari. It's not fair at all, reading through the comments. So the thing is, I mean, to be honest, this is a systemic issue, but no matter what hospital I've worked at, there are always VIP patients, right? There's always like celebrities or a cousin of a trustee or something like that you're supposed to immediately take care of them and provide the utmost level of healthcare, right? Even if sometimes it might be a little bit too much, they cut the line. And that's what it is. Unfortunately, that's the case, but that's what it is. And so how do you feel for some of these? I know these exist. What can we do as providers to help out with these kind of cases or help out with these disparities on a day-to-day basis?
Yeah, the VIPs, I don't know that. I don't really got the answer for. I don't got the answers.
I got you.
I'm limited in my role, and what in testing, that's an order that comes from a provider. So you'll get some people, VIPs, you'll get a text, as a charge nurse, you'll get a text about a VIP like an hour before they even show up, and you'll start seeing movement happen. You'll see people you never saw before starting to come down, like, hey, get this room ready, get this ready. The swab is already out for them. Meanwhile, I couldn't even find a swab for my admitted patient. That I don't really have the answers for that. I don't know how we change it. I think that's more so from your side. Because I can tell you this patient needs to be tested, but then you can say, well, this patient doesn't meet criteria, yet a VIP who's walking and like running better than I can get tested. So
Yeah, I always thought it was a problem. From our standpoint, the best we could do is advocacy,
Yeah.
like advocate for the patient as much as you can. Because even now, you will see, I'm reading stories that nurses are doing their own to get adequate enough PPE, right? And then some people are fearing for their jobs if they're speaking up about the situation. So it's hard. It's really hard. Kind of going through one of the questions somebody wrote, and you mentioned this before, you had coronavirus. You had COVID-19, right?
I did it.
And
I
you
had the right.
survived. You survived, sis. You
I
survived.
survived.
Tell me, how was it? Explain to the people what it felt like, what day to day, and then how you feel now.
So, when I worked 4 days in a row, and so I was off, and I felt like body aches, and I was like, this could just be from work. And then I felt hot, and I'm like, whoa, wait a minute. I've never had a fever in my adult life. So body aches, fever, I'm like, crap, I probably have it. The first 2 days were not so bad. The third day hit. My temperatures, I had a high temperature of like 103.9.